Hi everyone. Welcome to my presentation on improving Fontan circulation, organ and cardiovascular screening, a QI project performed at the Children's Hospital of Michigan within the Department of Pediatric Cardiology. I'd like to thank Doctors Jennifer Blake, Pooja Gupta, and Swati Sehgal who collaborated on this project. Background. The Fontan circulation is the common pathway after a number of surgical procedures for single ventricle or functionally single ventricle hearts. It allows for passive pulmonary blood flow within the Fontan circulation as well as systemic circulation provided by the systemic single ventricle. This physiologic change leads to long-term organ and cardiovascular complications. In 2019, because of these complications, the American Heart Association published the evaluation and management of the child and adult with Fontan circulation. This provides a framework for long-term follow-up of these patients. We identified that there is significant practice variation amongst providers at the Children's Hospital of Michigan and wanted to tackle this problem. The objectives of this project included identifying these practice variations, educating providers on the current AHA recommended organ surveillance tests and frequency, and encouraging increased compliance with these guidelines. As far as methods go, we chose adult, adolescent, and childhood cohorts based on ages identified in the publication. We identified patients that had followed up in our clinic who had Fontan circulation since the publication of these documents. And then within each cohort by age, we identified certain basic surveillance tests that we wanted to increase compliance with. The targeted screening exams by group were in adults, Holter monitors, exercise stress tests, and liver imaging. In adolescents, they were Holter monitors, exercise stress tests, and liver function tests. And in children, we included Holter monitors and liver function tests. The first PDSA cycle, or Plan, Do, Study, Act cycle, consisted of 3 interventions. One was to provide education to the division through a faculty division education session. 2 was to provide easy-to-use checklists that were printed and supplied to the clinic. And 3 was to develop a standardized Fontan circulation EMR template that would help users identify which tests were currently due. For results, within the adult cohort, we saw increases in Holter monitors of 14%. We saw increases in exercise stress tests of 7%, and we saw increases in liver imaging of about 13%. Within adolescents, we saw an increase of 12% in Holter monitors. We saw a decrease in exercise stress testing of about 13% within the context of the current COVID-19 pandemic. And in liver enzyme tests, we saw an increase of 10%. Within the childhood cohort, we saw an increase of 14% in our use of Holter monitors and a relatively similar percentage of liver enzyme testing with a 1% increase during the follow-up period. In conclusion, guideline-directed therapy of patients with complex disease, such as the Fontan circulation, can be directed using guidelines that are published by major societies. Often after the publication of these guidelines, there's significant heterogeneity within follow-up in a single division. Our PDSA cycle interventions led to increased adherence with the consensus guidelines in almost all of our identified adult, adolescent, and childhood surveillance tests. In the future, we'd like to move in different directions, including future division education and the implementation of EMR order sets to make these tests easier to use. Eventual goals include creating a multidisciplinary specialized Fontan circulation clinic. Within this clinic, we'd like to invite different subspecialists that are involved in the care of these patients, and we'd potentially like to identify a nurse leader that could help coordinate this complex follow-up care.